Let's see what are the steps involved in IVF. There are mainly two important parts. The first part is hormone injections and scans, and the second part is retrieving the eggs and transferring the embryo. So how do we do the hormone injections? So we start the hormone injections either on day 2 or day 3 of the periods, and usually there will be injections every day, and after a few days there can be an additional injection. During this time you may need 2 or 3 scans, and once the eggs are ready for collection, which usually comes on 13th or 14th day, then we retrieve the eggs under IV sedation or a sedation, and then on that day the eggs will be injected with the sperm and they will be allowed to grow in the incubator. On day 3 we check them and see whether we need to transfer them. Ideally we would like to take them up to day 5 and transfer the embryo on day 5. Sometimes we may freeze all the embryos and transfer them in the next cycle. That's known as frozen embryo transfer. Thank you.